It's one of the biggest problems in psychiatry today, and it goes like this. How many pills can a doctor prescribe when silence could help even more? Yep. I imagine every one of us knows somebody or ourselves that we are taking a psychiatric medication. They become all over the place. And in children and adolescents, it's gotten gigantic, taking medications for depression, for ADHD. It's become way too much, and it's actually doing some damage. I can't tell you the number of people that walk into my office, and when I ask them why they are there, their first answer, the first statement they say is, I need medication for my ADHD. I need medication for sleep. I need medication for depression or anxiety. Immediately, the topic is, I need medication. That's the thinking that now is happening more and more. Now, don't get me wrong, because psychiatric medications certainly have the power to be life-changing and life-saving. People with paralyzing depression, people with dangerous manic episodes, anxiety to the point of panic, which is causing high blood pressure, children who simply cannot focus. But unfortunately, psychiatric medications are given too often, and oftentimes for the wrong reason. Our society has become medicalized. We are medicalizing normal human emotions. We all go through fear. We all go through sadness, boredom, times of anger, the difficulties, the journey of human emotions. And yet what has happened is we are medicalizing this. We are turning these basic human emotions and calling them mental illness. Why is this happening? Well, for one thing is to understand that about 80% of psychiatric medications are being prescribed by the PCP and not by a psychiatrist. Not that the psychiatrists always know exactly what they're doing either. But we live in a world where medicine is more and more being controlled by corporations, and therefore the doctors are told, you have to see the patient in 10 or 15 minutes. So it becomes much more easy for a PCP simply to prescribe a medicine for anxiety or depression because they simply don't have the time to spend to talk about psychosocial factors. And for us psychiatrists, well, we have our problems too, because many of us are trained to look at things from the medical model. So we will jump to give medication when maybe more time should be spent looking on the deeper level, looking at the soul, looking at the emotions, looking at relationships. Unfortunately, many simply do not take the time, and many patients are demanding to be on medication because they don't want to take the time as well. Then there's the problem of what we call polypharmacy, meaning people taking too many medications. It starts off quite innocently. Somebody wants something for depression, so let's say they're given something like Zoloft. But sometimes with Zoloft, you can have problems. People can get more anxious, more agitated. So next thing you know, we add on some Klonopin. Then mood shifts start happening. So a mood stabilizing medication. Maybe they start complaining, they're hearing sounds, strange feelings are happening, so they get an antipsychotic. I can't tell you how many people come to my office and they're on 5 or 6 psychiatric medications. Quite honestly, it's ridiculous. There's all the side effects, and before you know it, you're in the midst of a nightmare. Way too many. And yet people keep on asking for these things again and again because there's so much suffering. Yes, there's so much suffering, and people, they want quick relief. That's the mindset that has been created. People are not willing to do the hard work. They're not willing to take the long, difficult road, which in the end will be so much better for them. And then, of course, there's those pharmaceutical companies, which have convinced us that virtually everything is what we call a chemical imbalance. If we can give a label to it, and call it a chemical imbalance or something, then it allows us not to take as much responsibility for what's going on. And also, again, opens our eyes up to maybe there's a pill that I can swallow, and everything will just be nirvana once again. So what to do? Well, first of all, the problem is not the pills. Nope, the problem is the PCP, the psychiatrists, the patient demanding pills, the pharmaceutical companies. That's where the problem lies. What do we need to do? First, we need to have a sense of balance. and know to use medications judiciously and for the right reason. But even more important than that is that we need to empower ourselves. Not simply throw a pill down our throat, no, but there's ways to empower ourselves. Exercise. Exercise is crucial, and we know that people who exercise many, many days a week makes a huge difference for depression, anxiety, mood swings, all of those. But I don't feel like exercising. You cannot lead with your feelings. You need to get yourself into action mode. Good nutrition, good sleep, being part of a community, extending yourself out to others. Many people, they live in their own little cocoon, are afraid. But again, to get yourself into action and to go beyond what you may be feeling. Action then will generate the feelings. And finally, and what I always emphasize is most important, is to know really who we are, to be connected to our soul, connected in a spiritual way, because that's the essence of who we are. We are not our trauma. We are not our depression. We are not our mood swings. We are, in essence, we are a soul. We are spiritual beings. So to be connected to that, not just one day a week, but every single day, to connect that can do wonders for our mental health. So how many pills can a doctor prescribe when action can help even more? The answer, my friend, is to stop swallowing again. The answer is stop swallowing again. Yep. Should have any thoughts about this? Any different thoughts about this? Please share your thoughts in the space below.